Good morning and welcome to the program Perspectives. This morning on Perspectives, we are going to be taking a look at the situation we have on our hands on the COVID-19. This program is also sponsored by Kaduna State Ministry of Health and sharing thoughts with us this morning on the situation of COVID-19 world over, back home in Nigeria and also back home in Kaduna. Professor Clara Ejembi of the Department of Community Medicine, Ahmadu Bello University Zaria, will be talking with us this morning. Professor Clara Ejembi, good morning and glad to have you on the program.
Yeah, good morning. How are you today?
Oh, we're good. All right. The situation that we have on our hands now and what is happening all over the world, the United States of America, Europe and other parts of the world experiencing a new strain of the virus. And back home, we've been told that Kaduna is also among the epicenters of the virus. And so the situation that we have on our hands in Kaduna State is on the rise, so much so that government has said that 1 to 13 officers should work from home, and that's becoming serious. We are not in a lockdown, but the situation we have on our hands may just be giving us a pointer towards the lockdown. But let's get to know, how serious are we with this new strain of the virus? Hello,
yeah, good morning once again, yeah?
Yes, thank you. Okay, let's go on.
Yeah, as you rightly said, Kaduna is one of the 3 epicenters of the epidemic in the country. The others being Lagos and the Federal Capital Territory. For Kaduna, the situation is even more alarming because when we look at it nationally, the proportion of tests that are increasingly becoming positive, is highest in Kaduna State. So there's a steep rise in the number of people infected, and that translates to a higher positivity rate of samples that are tested. And looking at the statistics that we have, in Kaduna State, for example, one of the criteria they have set for lockdown is if there's a doubling of cases within a month. In the past month, the positivity rate in Kaduna State has tripled, so more than doubled. At local government level, we've said if there's a doubling within 1 week, then we can look at how to lock down the LGA. By last week with 50, about 8 LGAs, the cases have more than doubled. In fact, in some LGAs, the doubling was almost 22 times, 8 times, 6 times. So the situation is quite right. But the government is being very careful to ensure that we take measures that do not adversely affect the economy seriously. Otherwise, we have gone back to lockdown.
Well, again, in Kaduna and maybe some parts of the country, we know that compliance to the protocols, set aside, to keep us safe from COVID-19 has been an issue. For now, what are you looking at for us, to stay with the protocols that are on ground for us to be safe from COVID-19?
As you rightly said, compliance has been a major issue. And so what government is recommending is to enforce some of the things we've been talking about. For example, business premises now, no face mask, no entry. At least that one can be enforced. If you go to the bank, you don't have a face mask, no entry. You go to a supermarket, no face mask, no entry. So no face mask, no entry. Secondly, you must maintain social distance, and these premises you must have facilities outside where people can wash their hands with soap and running water or use hand sanitizer. So at least that one you can hold the owners of the businesses responsible. Secondly, we have they've banned, nightclubs and all the other places that people congregate to entertain themselves in the night. Government has also directed that hotels should only open for businesses, for guests. Restaurants are also closed. Schools have been closed since last week on the 15th. We've also directed compliance, churches and mosques. We should now limit services to 1 hour a day and ensure that you don't admit people to more than 50% capacity, observe social distance, insist of use of face masks and use of sanitizers at the entrance. So those ones can be enforced by the relevant authorities in charge of these facilities. If they breach them, they can now be sanctioned. In addition to that, others will continue to appeal to members of the public to adopt the appropriate behaviors, and we are reviewing the risk communication strategies to ensure that we use multiple other media to reach the public. Use of social media, getting religious leaders to come on board, community leaders to talk to their constituencies, and all of that in the hope that people will listen. We're also appealing to people that this is the festive season. People are prone to travel. As much as possible, if it's not emergency, people should limit the travels. All the ceremonies that people do, marriages and all of that, limit the number of people to not more than 50, So these are some measures that have been recommended, and we hope that people will be responsible enough to comply. Otherwise, if the numbers continue to escalate, government may have no other alternative than to take more stringent measures to address the problem at hand.
I just may be asking now, Prof, what is it about us as a people? I mean, from news filtering in from all over the world, United States of America today, death rates alarming. And of course, we've been told also that we hear that health facilities are overwhelmed as it is now. In London, it is as bad, and other parts of Europe. And we hear all of this filtering in, and yet, staying to keep ourselves safe, by staying with the protocols is an issue with us. Is it the attitude of us as a people, or the trust deficit which is missing when you look at the leadership and the lead? What is it about us that compliance is just as bad as it is now?
I think the issues abroad and the issues here are completely different. When you take, for example, America, it's clearly an issue of lack of leadership, because the leaders should be role models to model good behavior. You have a president that does not seem to believe in science, and in spite of recommendations by the apex public health authority in the country, the president continues to be a super spreader, organizing super spreading events, rallies, and all sorts of things, and refusing to wear face mask. So there's a lack of leadership. Secondly, it's a country where people think their rights are paramount, and nobody should force them to do anything. They have a right to entertain themselves, to enjoy themselves, to party, to wear or not to wear face masks, to receive or not to receive vaccines, and all of that. So their own issues are completely different. When we come to Nigeria, the issues are a bit different. In Nigeria, obviously, there's an issue of trust deficit. They don't trust the messenger. They've lost trust in government. And they don't even believe that government is truthful about COVID-19. Some people still think that COVID-19 does not exist. Government is using that to try to make money. I don't know how. Then also there's the issue of low risk perception and feeling of invulnerability amongst the general populace. And I think it's all a matter of ignorance. I think. Then thirdly, we have the problem of barriers to access of the relevant things that we want them to, resources required to implement the protocol. Some people may complain about finance to get face mask. Some places, even water and soap is a major problem, not to talk of sanitizers. And then poverty is a major issue. You tell people to stay at home except when necessary. They have to go and look for their daily bread. People are living in quite overcrowded environments where it is almost impossible to social distance and all of that. So our own issues are quite some, but they are completely different from the issues they are grappling with in developed countries. Okay.
Yeah, Prof, is the stigmatization, is it still a problem with, why people would just not come out for testing of COVID-19?
I think initially it was a major problem, but from reports, from surveillance, from case management, from risk communication pillars, it looks like the rate of stigmatization is going down, because when we started the work, to even get people, to come for treatment, you go to the communities, sometimes they even threaten to stone the health workers or set the vehicle on fire. People needed to go with police escort, etc. to be able to, and we had to even involve police to forcefully evacuate people. But now more and more people are coming out on their own. So the stigmatization is on the decline, but it's still a problem in some areas, and it's also because of that people are refusing to look for help and in the appropriate places and come out for treatment.
Well, we do know, of course, that government has facilities where people can go for testing, and when they're tested positive, they can also be isolated. But talking about isolation, in the neighborhood or in our areas, just how many people, or with the level of poverty and the economy taking its toll on people, just how many people can be isolated, so to say, at home, knowing the way that we live? Isn't this an issue too?
I think the treatment centers are being filled up to capacity now, given the numbers that are being found to be positive. home isolation obviously will be a bigger problem in places where the home environment is not conducive. So you tend to find most of the people on home isolation are from the urban LGAs. So you are talking of the middle class people that have ensuite bedrooms where somebody and they are not overcrowded in the homes, and somebody can be isolated at home. So we are trying to look at explore the possibility of having community isolation centers, whereby in a ward, for example, a building could be identified, and if people in that ward are positive, then they can be managed in those community centers. The ward development committee members, the ward worker people, and other community resource persons can help do the monitoring and ensure compliance. So this is the direction the response is taking, and that possibility is being explored. And I think very soon, perhaps, implementation will commence. And that way, we can decongest the treatment centers, the isolation centers, and also promote community in the management of cases. And also, if people are being treated at home, compliance may be higher, and stigma and discrimination may be reduced.
Well, Prof, I'm also looking at Kaduna State and looking at the 23 local governments. We do know that some local governments are at high risk in cases of COVID-19 on the rise in this local government. Is there a way, that we can look at these high risk areas as where to, put the lockdown, or that some of us may be thinking about at this time?
Well, as I said, we are increasingly looking at the data, and we are analyzing it on a daily and weekly basis. For example, last week we had 8 local governments that met one of the criteria for localized lockdown, where there's been more than at least a doubling of the cases in the preceding week. And then we are also looking at the very high burden local governments. And unfortunately, the high burden local governments, Kaduna North local government tops the list by far. We have Kaduna South, we have Chukun, we have Igabi, and other local governments. So what we have tried to do is to at least mobilize teams from the state level to go and hold the hands of the rapid response teams at the local government area to strengthen the response. And obviously, if we think of a lockdown, we have to be careful. What exactly do we mean by lockdown? Are we going to lock down and stop movement and everything, put a copy 24 hours in Kaduna North and all these centers of commerce of the state? The repercussions will be quite strong. And so we are currently in discussion at the state level to see how we can, what other additional measures we can put in place in the high burden LDAs and the LDAs where cases are public. So the strategies are still being discussed, and we're trying to work it out.
Well, Prof, again, people are presenting with cases of, cough and, loss of smell, loss of taste, and so many of it that one could link up that this could just be, symptoms of COVID-19. And the weather right now, again, may not be helping in these matters. Are you concerned that, again, people are just laying back and looking at the local pharmacy or where they can get treated? Is this an area of concern for you now?
Yeah, obviously, right, we know that this is a season where upper respiratory tract infection becomes prevalent because of the weather, the dust, the cold, and all of that. So we recognize that, but we also recognize that the environment also, the weather is stimulating, the spread of the infection. And we advise everybody with respiratory symptoms to get tested, because you never know who has COVID and who does not have COVID. And especially if you are beginning to have loss of smell and taste, that is not associated with any other upper respiratory tract infection except COVID-19. So anybody, no matter how mild you think it is, if you have a respiratory tract infection, please go to the nearest testing site and avail yourself of the test. That way, at least if you are positive, you can isolate yourself either at home or in the health facility, depending on the recommendation of the case management team. And if you isolate yourself, you are helping to limit the spread of the infection to your loved ones, your neighbors, and the people in the community. So please, my appeal is anybody with a respiratory symptom, fever, and all of that, go and get tested. So together we can contribute to the fight against this COVID-19.
Yes, and just before we go on this break, Doctor, getting isolated, when tested positive, will there be, we're talking about drugs being prescribed, that will be taken care of by, by government or the health facility nearest to you?
Oh, sure.
Okay.
Because when you are found to be positive, we have the criteria for determining who goes to the isolation center and who remains at home. So first and foremost, you can only be considered a candidate for home isolation if you have no symptoms or your symptoms are mild. There's somebody at home to look after you. The home environment is conducive for self-isolation. There's a room that you can stay on your own. There's a toilet you can use on your own, and you can be able to observe all the other protocols. So if that is possible, then they can accept for you to self-isolate at home if you so desire. And the caregivers, the health workers in case management will make the drugs available, and you'll be monitored every day. If your condition worsens, you'll be evacuated to isolation center. Otherwise, if at the end of 10 days you don't develop any symptoms, based on current science, you are no longer infectious and you can be allowed to move around.
Okay, Prof, we'll have to go for a commercial break. I'll join you after this break.
Okay, thank you.
Welcome back. Is the program Perspectives this morning, and we're looking at COVID-19, the situation world over and back home in Nigeria and in Kaduna State. The Ministry of Health, Kaduna State, is the sponsor of this program, and Professor Clara Ejembi of the Department of Community Medicine, Ahmadu Bello University, with us as guest. COVID-19 is real, and of course we've been told to keep to the protocols and stay safe from this disease, so to say, that is with us. Prof, I just want to get it clear here. This second wave of COVID-19, as some would say, it's coming with a variant, and that's why it's the death toll is on the rise with it. Are we having from what we had before, is the variant here, is it affecting again this new strain that we're getting?
So far we have received reports of a variant of the virus that has been detected in South England, which is about 70% more infectious than the other one that has been around from the beginning of the pandemic. So it has spread faster, but it has not been shown to be more severe than the other virus. In Nigeria, the African Center of Excellence in Genomics at Redeemers University said they have even picked up this trend in the samples they've analyzed in Nigeria since August. And of course, you know that in the country we have limited capacity for genomic evaluation. But from what evidence is available, looks like this variant is already in the country. So it might contribute to the upstart in the infections that we are seeing. Because the number of people getting infected, is much higher than even during the peak of the first weeks.
Well, the world is glad to know that pharmaceutical giants of Pfizer, Moderna are all up with the vaccine for coronavirus, and it's been transported to all parts of the world now. But our concern again may be that with the vaccines, is it saying that we may just be free from COVID-19, or it will still be there, but the vaccine can take care for us?
The vaccine will not eliminate the virus, unfortunately. So what the vaccine seeks to do is to prevent people from getting severe infection. They might get infected, but the vaccine will kind of neutralize the virus so that you don't get severe infection. So that's like a primary prevention. But in terms of interruption of transmission, unfortunately we'll have to fall back to the non-pharmaceutical protocols that we've been promoting. Because if enough people are using face masks, the virus will not leave one person to get us to another person. We are washing hands, we are doing all the necessary things. These are the behavioral vaccines that will interrupt transmission. But otherwise, if we are depending on vaccines, first, to even start talking of interruption of transmission with vaccines, you must have a high level of herd immunity. When you talk of herd immunity, you are talking of the level of immunity in the population. And from the science we know from school days, the herd immunity must get to more than 80% for interruption of transmission to take place. I doubt that we have the resources to immunize 80% of our population. Even with the BCGs and all the other things we've been doing for 20 years, we've not achieved that target. And the companies cannot even produce that quantity. Even in America, I was just listening to CNN yesterday. They said that before they can even finish immunizing the healthcare providers and get to the general population, it might take them till June. And of course, in that country, they also have issues of vaccine hesitancy, just like we have here. Nigeria, even if we want to achieve 80%, first, I don't think we have the resources to procure the vaccine. The logistics to transport it, the cold chain, and all of that we don't have. Available information points to the fact that the country is planning to order 20 million doses. And if 20 million doses, so an individual needs 2 doses, that means that we are talking of just 10 million people. So we by the time you talk about the health workers and all of that, and look at the population of the country, it's a long way towards getting that level of immunity that we can even talk of interruption of transmission. So unfortunately, the virus is going to be around, and so we are appealing to people to modify their behaviors and adopt all the protocols that people are recommending if we want to win this war.
Well, this time again, will it just be okay to, bring back the enforcers, that as we had before, bring back the courts too on our roads, so on COVID-19 to keep ourselves safe?
You may want to look at it that way, but even the enforcers, will they come and wash your hands? They don't know that you are washing your hands or you are sanitized. And when they were even on the road, it's only when you are approaching where they are that you quickly put the face mask. The moment you move, you remove it. So I don't know how effective that is. But if we, at least we know that behavior change takes time. And this in theory of change and all of that behavior, it takes time. So it's to continue to reinforce the messages, to continue to at least look at how best, we can get the messages to people in such a way that they can connect with it, they can personalize it, and they can accept that there are benefits to adopting these behaviors, and they have the support and the resources to do it, and get messengers that they trust. Then perhaps we'll begin to see changes. But we still have a lot to do in terms of investment and activities in the area of risk communication.
Well, it's a festive period that we're in, and one of the ways that we show, the mood of the occasion is, being kind to one another, express, love by giving, so to say, and people show a lot of kindness, joy and happiness at this period. Again, your call to how we go about this period.
Come again?
How we go about, celebrating this period. It's a festive period. We express love, kindness, and, by giving and, of course, visitations and all of that. Your call, as to how we should go about it this time.
I think I've been telling people, first and foremost, if you don't need to travel, please stay at home. Because you'll be carrying the virus from one place to another. You can, if you are in Zaria, you are going to Kafanchan, for example. If you carry the virus from Kafanchan, Kaguru to Zaria to Kafanchan, or pick it from there. So limit non-essential travel as much as possible. Have quiet celebrations. All these visitations should be cut off. People will understand. You can socialize by calling people, doing WhatsApp, social media, whatever it is. Limit as much as possible, physical visitations. You can share food, you can do whatever, but don't go and be sitting and gisting and all sorts of things. Our forward campaign is still on. And one of the acronyms is R, remain indoors as much as possible. We did Salah, most people were at home. Salah was even during lockdown. And people are tired, so we can still repeat it. It's the same, it's the spirit, and it should be this time a time of sober reflection of what Christmas means to you. It's not all about eating food and visitation. It's establishing a relationship with your maker. So you can do it quietly and stay at home.
This is the new normal that we're in, right?
Yes, that's the new normal. The new normal.
Okay. All right. let me bring the audience here, and yes, to all of you out there, COVID-19 is still real, it's still with us, and of course, it's taking another turn this time around, and we all want to be safe and to keep ourselves safe, and so must stay with the protocols on ground for us. Time to ask questions, and make your comments. Professor Clara Ejembi is just there to answer your questions. What are you seeing in your neighborhood? What are your concerns here? We'll begin to take your calls on 081 40989, 081 40989, or 070-87-800-989, 070-87-800-989. Hello, good morning.
Good morning, Mr. President.
Good morning.
Good morning to the press. Yeah, I'm to Engineer Manuel.
All right, Engineer Manuel.
Yeah, in all education, no more this pandemic is here with us. But my own observation, where are the mobile courts to enforce this nose marks or face marks or whatever is being called? Where are they? Because we are told when the first instance has not come across anyone in any area, and people should have it at the back of the mind that this areas, before, because it was just how to make money. It is obvious now that we know that this thing is real. So they should help to the COVID-19 protocol. Like me, I always emphasize, I will love leadership by example. If they are telling us to do something, they should look by example. Because at the end of the day, it is the common man that will feel the heat. They have gathered a lot that if they lock down for a year, they have nothing to worry. But what about the common man? If they should be doing leadership by example, in the sense that if they say no much gathering, they should reduce their social gathering and their political gathering that they are doing. So that the common man will say, yes, this is a leadership by example. Okay. Not telling the common man that they should observe all those, they should stop large gathering. But now you see them, when they are doing one coronation or the other, you see them choke up there.
Okay.
What they said the followers to do.
All right.
So please, let them have this at the back of their mind. Let them be doing leadership by example. And I hope they have put measure in place to curtail this issue of COVID-19.
Okay, good morning, Emmanuel. Good morning, thank you. We'll take another call. Hello, good morning. Hello, good morning.
Hello, good morning.
Yes. Good morning.
Hello, good morning.
Yes, good morning. Can you hear us? Okay, we have a problem with that line. Hello, good morning. Good morning.
Are you hearing me, sir?
Yes, go ahead.
Yes, I'm congratulating the exam, sir.
Okay, let's hear you.
Sir, what I want to add is, Professor, is that now the vaccine are out. But on the news, we heard that there's another new corona in around UK. Are they going to amend this vaccine, or they will come up with another process? So we'll be able to know. And this morning also we heard that the person is going to order some vaccine, and they started saying that it's going to cost about billions of naira. UNICEF was suggesting that out of the budget of 13 trillion, they should take 1 trillion and reserve for to treat this corona COVID-19.
Okay.
Finally, I thank the Kaduna State government and Indisa for bringing in this program. In fact, we are listening, and definitely by the grace of God, we are going to follow all rules and regulations.
Okay.
Thank you, sir.
Thank you, Comrade Gabriel. We'll take one more call and then come back to Professor Clara. Hello, good morning.
Hello, good morning, Mr. Bala.
Good morning.
Thank you very much. Good morning to Professor. My name is Mr. Bala.
All right, Musa Bala, let's say.
Yes, let me start by giving thanks to our Creator, federal government, national government, and Victor FM for consistently enlightening the public about what COVID-19 is all about. I think it's worth commending, and we want to thank you again. And COVID-19 is real. The second wave has come out. We have seen it. And all measures being spelled out by commercial government is always one of the best key way out of it. Nigerians should continue to encourage people
to abide by the regulations so that we minimize the effects to the barest minimum. We should not be misleading people. We should not be supporting unnecessary issues with this regard to COVID-19. We should stop misinterpreting it in any of our personal ways. We should not be in support of COVID-19 palliative steps where we justify it by all means. And at the same time, if the people among Nigerians that have what to do should equally extend their helping hand to those of us who might not have something to do. Not that maybe somebody will come and say he has a garden in his house, yet he cry more than anybody when it comes to palliative, or he justifies the looting of public duty. These are the people that increase the inflation in our society. So we should not listen to them. We should listen to government, and we should do the best to ensure that this thing is not in our midst. Once again, thank you all. Good morning.
Thank you, Musa Bala. All right, Prof, I'll just come to you. Engineer Emmanuel was first, Comrade Gabriel, and Musa Bala.
Okay, thank you very much. I think the first speaker talked about leadership by example.
Yes.
Absolutely. You know, we cannot say one thing and do something different. People are watching us. And it's not talking the talk, just walk the talk. It's not do as I say, not as I do. So, we look up to our leaders. Whatever regulations and pronouncements and directives they give, we should see them abiding by them and implementing them. So, we recognize the point that you made during the time of coronation, how, you know, there was serious flouting of regulations. I think it started with the death and burial, and for some things it was very difficult to control anything. But immediately after the event, the state government, the Ministry of Health, quickly mobilized people to go and ramp up risk communication and carry out massive testing. I think within that week, we were able to test more than 4,000 people in the wards where the crowd really gathered. So there are situations where perhaps it's impossible because of sentiments and the culture and things to enforce the protocols. But obviously, we don't expect our leaders to go doing one-day marriages and all sorts of things and inviting the whole Nigeria to come. It will be irresponsible behavior because we don't want our citizens to do it. So our leaders should also not do it. If we say wear face mask when out of your house, every leader, we should see them wearing it. Not sometimes we see them on television in crowds, not wearing them. So I agree with you absolutely. Leadership should be by example. Secondly, you talked about enforcement agents on the street. I will reiterate what I said earlier. In this phase of the response, Kaduna State slogan is take responsibility for yourself, for your loved ones, and for people in the community. So we should take responsibility. And taking responsibility means we should imbibe these things, ensure that we do them, and monitor to ensure that our neighbors, our family members, others in the community do it. So we should police ourselves. We should not rely on people coming to do the enforcement for us. And there are certain things that even as I mentioned earlier, some of these things will just be first service, and the moment the people are not there, we go back to normal. We should imbibe this behavior so that they become a way of life. And let me reiterate what we want you to do. And it goes by the acronym of FORWARD. The first one is face mask. The face mask is your shield, wear it always. O is observe social distance. at least 2 meters apart, 2 ankles apart, or 6 feet apart from other people. The rule is washing your hands always with soap and running water. In the absence of that, use hand sanitizer. Right? The other is avoid crowds. So anywhere the place is crowded, where you cannot do social distance and all of that, market, ceremonies, all of that, avoid it. Right? R is remain indoors. Remain indoors. Except when absolutely necessary. All this all this going up and down. You should limit it. G is diet. Diet is key. It prevents infections. A healthy diet. It also helps in the healing process. So take responsibility as we march forward in this phase of the campaign. As I said, when you now force people, it has not become a way of life. You do it only to avoid being caught, and the moment the people are not there, you go back to normal. But we want a behavior change in such a way that it becomes a way of life. The second issue was about the vaccine. We recognize that a new variant of the virus is coming out. So we need to be able to see whether the vaccine currently being produced is also efficacious against this variant. If not, then there might have to be modification of the messenger RNA that is used for the vaccine production. Obviously, the cost of the vaccine is quite high, but of course, it's left to government to at least get our priorities right. So we do know that we need the vaccines, but also there are also some competing demands and resources are quite finite. So we expect the government to at least sort out priorities and ensure that even as we are sorting out COVID-19, other health needs and other needs would not suffer unnecessarily. And finally, I agree absolutely with the last speaker that we should abide by directives of government. We should be supportive of government. That is quite true. We should not go stealing palliatives and all of that. But obviously, we expect good stewardship also from our government. We want a government that is responsive, a government that happens to the cries of the people and knows where the shoe pinches, and the government that will put in place interventions to be able to meet the needs of the people. Obviously, we know that in these difficult times, the poor people are the ones that are suffering the most serious brunt of the epidemic. And if we have a responsive government, I'm sure we will not be keeping palliatives for months, and some of them are getting rotten. So government should also do the needful. Government should ensure also that there's equity, there's also transparency, and there's also accountability in its dealings with the people. And as people in the community, responsible citizens, we should also be our brother's keepers. For those of us that have more than enough, philanthropy and giving, the currency is a bit short here. When you see people abroad, you see people coming out, bringing things, giving people food stuff, giving people clothing, volunteering to work and all of that. We don't seem to see a lot of it in our community. So we appeal to people, to get involved in community service and also to be able to support the poor amongst us, so that at least collectively we can survive together. It is all these inequities and the lack of people, the poor watching the very rich, flaunting their riches and not giving out, and all the inequities and all of that are some underlying factors for the crimes and all the other things that we have seen. But obviously we are all responsive, and government is responsive, the citizens are up and doing and supportive of one another. I think we'll have a more peaceful and progressive society. Thank you.
All right, Professor Clara Ejembi, thank you for coming on the program with us this morning. Yes, and that will just be about the size of it on Perspectives this morning. COVID-19 world over and back home in Nigeria, back home too in Kaduna State, where we are with it. Professor Clara Ejembi, our guest this morning. She is of the Department of Community Medicine, Ahmadu Bello University, Zaria. Dashin, thank you for connecting me with the people. Wisdom, thank you for putting us in the pictures. Good morning.
This quick commercial break. Are you serious? For real, are you serious? It's Victor FM.
Sudrex tablets domin ciwon kai. Haka ne. Sudrex tablets ga manya kamar ko. Sudrex tablets na yaye ciwon kai. Domin samun sauƙi da wuri. Na ce nemo Sudrex tablets idan kana jin ciwon jiki. Ana amfani da Sudrex a kowane lokaci na rana. Sudrex tablets yana tsaye da ciwon kai. Domin samun sukuni yin aikace-aikacenka. Ana amfani da Sudrex a kowane lokaci na rana. Yi amfani da Sudrex domin ya taimaka ma a samun saurin sauƙi daga ciwon jiki. Samu sauƙi da sauri daga ciwon kai da Sudrex.
Sudrex tablet yanzu a cikin sabon faki kuma yana da tagwayen sinadarai. Yi amfani da Sudrex tablet domin saurin samun sauƙin ciwon kai da ciwon jiki. Idan bayan kwanaki 3 ba a samu sauƙi ba, a tuntuɓi likita.
Muna gabatar da sabon gram 5 na dunkulen Genomax. Dunkulen na da ƙarin girma na kashi 25 don abinci mai daɗin ɗanɗano. Akwai mai ɗanɗanon nama da ɗanɗanon nama da kayan ƙanshi. Akwai kuma mai ɗanɗanon kaza da ɗanɗanon kaza da kayan ƙanshi domin baiwa abincin ku daɗin ɗanɗano. Gram 5 na dunkulen Genomax, girma yafi.
Let's start the party.
You are gonna love this show. Invicta 98.9 FM.
News.
Get the latest news in Nigeria and the world over on Invicta FM. We give you the latest updates and keep